Okay. So he is a professor at Northeastern University in the Bouvet College of Health Sciences and adjunct professor of Ergonomics and Safety at Harvard T.H. Chan School of Public Health. He is also the Associate Director for the Chan School Center for Work, Health, and Wellbeing. Dr. Dennerlein is an engineer whose research in public health takes a systems approach to understand and prevent work-related injuries and improve worker health and well-being. So without further ado, first keynote after that.
Do I need a microphone, or is this okay to speak without a microphone? I can't stand still very long or sit still very long either, so I like to move around, and we'll see how that goes. But also, I can move this with me. Yeah. Okay, so this can move with me. So I want to thank the Madison County for having me as one of the speakers today. It's an honor to be here and talk about the work from the Center for Work, Health, and Wellbeing at Harvard, but it's also nice to be back here in upstate New York. I am an upstate New York boy. We're here in Hamilton today, and I thought I'd start off with a map. I actually went to the University of Buffalo, and when my freshman year, I actually had a map of New York on my door, and everybody on my floor signed where they were from, so it was kind of nice. So I actually grew up and was born, let's see, what's next? I have to do. So I actually just came from Jamestown, where my aunt lives. I went there for the weekend and got some furniture from my grandmother, and driving it back to Massachusetts, where I live now. But I actually was born in Elmira, New York, and grew up in Horseheads, and that's where my mom lived for 60 years of her life. She just passed away a couple of years ago, and we sold our 50 acres that she lived on a dirt road there. But for a little while, my dad actually did lose his job in Horseheads, and we moved to Syracuse and worked at the General Electric there in Electronics Parkway. And so for 4 years, I went to Liverpool High School, so right up the road from here. And also, and I wanted to show you this. This was just on my Facebook last week. That's Matt Mulcahy. I don't know if you know who he's on Channel 3, STM. I went to high school with him. We were in The Wizard of Oz together. He was the Scarecrow. And that's Laura Hand, who, this was just, I saw this, I'm like, when I was preparing the talk, I'm like, hey, this is where I'm going. And this Laura Hand, who just retired, and I remember seeing her on the noontime show, and it was kind of, I was like, oh, this is like people I know. It was just kind of nice. Anyway, I just thought I'd show you that. Let's see, what's next on my, I went to the University of Buffalo, so from that part of New York. My dad actually went to Alfred. That's how we ended up in upstate New York, was he went to Alfred University. My mom actually was born in California. And then my spouse's family is from Glens Falls, Hudson Falls, New York. And also, and they went to Hamilton. And also which is right up the road in Clinton, not in Hamilton, but in Clinton. And then my sister went to Colgate. And then my nephew also went to Morrisville. So very a lot of connections. And nowadays, let's see, and this is where our house in Western Mass, we bought a second house. When my mom died, we took the proceeds from her house and bought a house that was closer, so we didn't have to travel 6 hours, just 2 hours to enjoy a country house. And so now so we're pretty close. So that's my history. I feel very much at home in upstate New York, and the beauty of this weekend has been just fabulous. What a weekend to come. So thank you for having me. So I want to talk to you today about this idea of total worker health. What does that mean? What is the approach? And how does it impact work? But also impacts businesses. And I think that's one of the things that I want to emphasize today. I also know it's important for the county, and we heard about it, that a healthy workforce is healthy for business. I think that's one of the key messages I want to provide with you today. And one of our shared goals that I want to present today is this idea of, it's both protecting the worker from the hazards of the workplace, but also then promoting their health, and also realizing that even these, like the mental health issues, often have a lot of root causes in the workplace. And what can we do in the workplace environment to help people with mental health? And what kind of, not just tertiary kind of prevention, but also thinking about how can we set up a psychologically safe work environment for workers as well. And that's some areas. We have a speaker that we just invited to come talk to our center from the Harvard Business School, who's done a lot of research around psychological safety for workers and the like. So that's one of our one of our shared goals. Sorry. What I'm going to be organizing my talk around today is why invest. I'm going to start off with some of the business reasons for investing in a healthy workforce. A little bit about what works best and sort of the philosophy and the conceptual framework around total worker health. And basically that the conditions of work really impact health and how they do that. Talk about our Total Worker Health Center a little bit at Harvard, and a little bit about the philosophy around that and the approaches and characteristics. And finish a little bit of some of our work around small and medium-sized businesses. So that's what I'm going to talk about. So I'm going to first talk about why invest. And one of the big things around total worker health and investing in worker health is that it improves brand, and there's also return on investment. There's a lot of research around this. I'm going to show you just a little bit about, this is a paper done by Ray Fabius, it's a couple years old now, where he looked at companies that were rewarded for, I study human factors and these things are always a pain. Looked at market performance of companies, companies that won corporate health achievement awards from the American College of Occupational and Environmental Medicine. And what he did was looked at their market performance over about a 15-year area. And you see that from 1999 that the Standard & Poor's and index was fairly flat over that time. Of course, the recession of 2008. But when you look at the companies that invested in occupational health and safety and worker health, you see that they outperformed the other companies by a lot. And so this is one of the initiatives, and there's other indices. This is the HERO, which is the Health Enhancement and Research Organization. They had their sort of top companies that they looked at, and again, they saw this was looking at their returns and growth over a period of the same time, looking at Standard & Poor's 500, saw also a larger return on investment and things like that. Boom. And also this is the C. Everett Koop National Health Awards. This was just looking at companies that invested in health, not just occupational health, but just health. And they saw similar trends as well. And so showing that that these companies who do invest in their workforce do seem to perform better in the marketplace. And these are some of the the lagging indicators and some of the performances of that. And so that's one of the pieces of evidence I want to get to. And when we look at Madison County, we've already heard that they're second in the state of creating, looking at in terms of value around health. And we see that, that their report back in 2009 really talks about the fact that we are talking about social capital and human capital here, and that, the people are the principal asset of our workplace. And I like the second quote, which is that healthy people are healthy for business. And I think that's the bottom line when we think about why invest in worker health and safety. So, what works best in terms of this, okay? And when we think about it, traditionally when we think about worker health, our approach is often, by the way, I redid this slide trying to make it look like barn silos from upstate New York that I grew up with. I'm not the greatest artist, but I thought I'd explain what I was trying to do here. Anyway, our standard approach for worker safety and health is to have silos. We have our safety department, we have our environmental health department, we have our wellness department. We have these different departments. And they often work by themselves. And they're not talking, they're not integrating, they're not looking at how do we cross these borders and help each other. And so this is our traditional way. And so, about 20 years ago, there was a lot of work being done in the workplace about smoking cessation programs. And my colleague, Gloria Sorensen, was doing this work in a foundry where she was trying to get the workers in this foundry to stop smoking. And finally someone pulled her aside, an old salty dog worker, came and said, honey, why should I bother quit smoking? I'm already exposed to all this crap in the workplace anyway. My lungs are getting, are suffering from the fumes that I'm exposed to on the job. I mean, this is actually a painting from 100 years ago, but if you've ever been in a foundry, they don't look that different today than they did 100 years ago. A lot of fumes and stuff. And so the point that this guy said was, why bother? Because my lungs are already being damaged by what's in the air. And this was an aha moment for her because she realized that I couldn't just go in and tell people to stop smoking and really work on their behavior. She thought, I have to do something to change the work environment so that people felt that it was beneficial for them to stop smoking. And it would help them overall, and that the workplace had to be changed in order for her to be successful in getting people to quit smoking. It wasn't just saying no, it actually had to be a systems approach. And that was really the beginning of the Total Worker Health Initiative. And she actually came up with an intervention where she looked at this. And this was a study where she looked at, it's called WellWorks 2, that's our name, but essentially they looked at 15 work sites with almost 10,000 workers on them. And what they did was they randomized those work sites into two different types of intervention. One where they just did the traditional health promotion, the smoking cessation programs that people have been doing for a while now. But the other side, the other sites got both an occupational health and safety intervention as well as a smoking cessation program and looked at it. So that was, the randomization was into those two types of arms, was one had the combined. And what she saw, and this was, they had looked at both salary workers, the office workers, salary workers, as well as the hourly workers. And so what this chart shows is the hourly workers here, and then the salary workers here. And the difference that they saw was really in the hourly workers. So this is quit rate. I forget what the denominator is, but you see that this is the just the health promotion sites only, and this is the health promotion and the occupational health programs. And so what she saw here was in the hourly workers is that when they combined the occupational safety and health intervention with the health promotion intervention, the quit rates doubled. And that was a significant finding. And this is really the beginning of this effort towards total worker health. Salary workers did see an increase, but it wasn't significant in terms of, statistically significant in terms of the difference here. But they did see an increase here. But really the big benefit was in the hourly workers here. And that was key in terms of that, in terms of the findings. So this is one of the key studies that began this whole movement of this idea of total worker health over about 20 years ago. There were other benefits. They saw the sensation use go up. They saw higher participation of both workers and management. Through this process, they engaged more people, and engagement, it seems to be an important factor around in business these days. If you get the workers engaged and they just respond a lot better. And they also saw improvements in occupational health as well. So not was it just two silos going down the road parallel, they actually saw synergy between the two of those ideas. And a lot of that is related to sort of the conceptual framework around this. And I'll get to it in a moment, but the idea that it is, think about a worker in an environment where they have to choose something. They have to choose food that they're going to eat that day or that night, or they have to use some sort of piece of safety equipment. This idea comes from my human factors background of how do people use information to make decisions around what they're doing. And so think about a hospital worker who's got to make a decision of how they're going to move a patient safely. Okay? What are the factors going into their head when they're at the bedside? What are all the factors that are going on that are going to allow them to make a decision to be safe or not safe? And this is a classic example. So thinking about this, do I have the tools to do the job that I need to do and to do it safely? So the physical environment is an important aspect of someone making a decision whether it's about smoking or not smoking, using a piece of equipment or not, okay? Whether the food available to me is there or not. Construction workers have huge limitations on the food available to them. In fact, there was just a study came out of Florida that talked about food trucks at construction sites. And if you've ever seen those, they're not very healthy food trucks. In fact, they've got nicknames. But anyway, the physical environment, the job demands, do I have time to get this done safely? We often hear among workers, I don't have time to go to the gym, I don't have time to use that equipment, I've got to get this done now. And so they take shortcuts. And often we hear this in construction where productivity overrules safety, and that's often an issue in terms of of what's happening here. So is the job demands and sort of the culture around it really saying, is there time to use this equipment in terms of the job demands? The work organization is also important. Okay, the work organization in terms of, is there, is my work sort of set up that I can use this equipment efficiently, or is it sort of fighting with my work organization? That type of things. Also, do I have the authority to use this equipment? Do I have the authority to come and make a decision and use it? Or do I, or is this for just, for example, we saw in an intervention study that the nurses would use the equipment, but the patient assistant, care assistants, the PCAs, didn't use the equipment because they didn't feel trained and knowledgeable enough and had the authority. So they weren't using it as much. And that was one of the things that we saw in an intervention study. And finally, is the culture. Is it normal to use this stuff, or do people make fun of me for using this kind of stuff? Is the expectation among my supervisors to use this stuff, to use the safety equipment, to use the the cafeteria that's open during the day, is the food there available for me and that kind of stuff, and is it sort of culturally acceptable? We saw this with construction workers, where we did a lot of on-site training, and we saw more of a community of co-workers supporting each other to eat healthier and to bring better food to the work sites and things like this, and actually competing a little bit and saying, hey, what did you have in your thing? And that was in one of our intervention studies. We saw that kind of approach. So basically, the idea of that slide is that all these components are influencing the worker. The worker is actually responding to the work environment in these situations. And when we think about behavioral-based approaches to both safety and health, we have to remember that behavior is can be a result of the environment. And we've realized this in transportation for a long time, that we design transportation systems realizing that humans will respond to the environment. Road signs, road designs, car designs, all of that is designed with the understanding that the human will respond to that environment. Okay, and also the cultural aspects of that. I don't know if anybody's driven in Boston, but compared to driving in Syracuse. Or Texas. Eric and I were just talking about Texas, where he was just visiting there, and I have a sister who lives there, and whenever I drive in Texas, people drive wicked fast. But anyway, the idea of this is that the conditions of work play an important role in this behavior. Okay, and that's the idea of that slide. That's the idea of total worker health, is thinking, and our center is really thinking about how can we change the conditions of work, whether it's the psychosocial factors such as supervisor support, co-worker support, it's removing hazards and reducing hazards in the workplace, and also thinking about the organization of work. A big thing in our construction workers that we've seen around mental health is work-family conflict is a huge issue around mental health. Because construction workers, especially in Boston, they live in New Hampshire, they commute an hour, they have to be at the work site by, usually, to make sure that they compensate for traffic, they often have to leave, twice as early as they usually would have to. And so that means they're out of the house before the kids have gone to school, or even awake, kind of thing. And then they will work late because the project's behind schedule, and so they didn't get home until the kids are already in bed. And so that kind of work-family conflict is one of the things that we're also seeing, and that's part of work organization as well in terms of that. So it goes beyond just, it's how does the work impact that sort of, that aspect of life as well. So what is total worker health? Cha-Cha Chang is here from the National Institute for Occupational Safety and Health, and I'm sure she's going to be talking about this too. And this is the definition from the NIOSH website. Looking at, it's defined as the policies, programs, and practices, which really is the work environment, right? It's all the things that influence the conditions of work. That integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker and well-being. And I think I put this after describing the foundry and the health worker and understanding how they make all these decisions. And I think that's sort of what I wanted to do. So Cha-Cha is going to be talking about this at 1 today, and I'm excited to have her here. So the total worker health is a kind of a field, but it's also an initiative by the National Institute for Occupational Safety and Health. And they have two major extramural activities. One is the affiliates program, and these are affiliates across the country. I I think that's Madison County. Maybe Madison County's more like there, but that's okay. And then the centers of excellence, you know I'm a map guy, so that's why I'm looking at this. And then there's 6 centers of excellence. And I'm here representing the Harvard Center. There's also one at UMass Lowell and UConn. There's one in Chicago. And we all have different, we complement each other in terms of what we're looking at. And the CPH-NU, which is UConn and UMass Lowell, they're looking at participatory approaches. The University of Illinois Chicago is looking at the precarious work environment, a lot, dealing with community health centers and the like. The Center for Midwest, which is based in Iowa, but they've got partners at Washington University and St. Louis. They're looking at, they actually have a whole bunch of programs in construction, but also rural communities. In Denver is the Center for Work Environment, the Center for Health, Work, and Environment. It's just all the same words, just different orders. But they're looking at small businesses. And then the Oregon Healthy Workforce Center, they do a lot around leadership training in terms of what they do. And then all the affiliates. And one of the affiliates here that I want to point out is that the center, that Madison County is one of them. We are also working with Dartmouth-Hitchcock, and there's also Health Partners in Minnesota are some of the other ones that we've been working with. And then this is our center. You can check out, we're a multi-institutional center with based at Harvard, but also at Dana-Farber, Northeastern. We have Health Partners, that's Nico Pronk from back here. And this is Gloria Sorensen, the director of our center. Partners Healthcare, we've had a long partnership with Boston College of Social Work with Erica Sabbath, who's one of our principal investigators. We actually are also in Kansas with Jennifer Williams, who's leading one of our outcomes. And then Boston University with Les Bowden is one of our collaborators as well. What we do as a center, we have sort of 4 areas of emphasis that we do. We do research. We also disseminate our evidence-based practices. That's what I'm doing today with you guys, sharing our experiences. We actually also are looking at how does our research support and can impact policy, and also policy at a micro level or within a company, but also public policy in a much larger kind of framework. And then also we build organizational capacity. And one of our research projects that we're doing now is how do we help vendors such as insurance companies and brokers help provide them, what kind of training and capacity do they need to help disseminate total worker health approaches beyond just their own organizations. I pulled out my clock so I would have a time. Okay, I'm doing fine. So let me talk about some of the research that we've done at the Center for Work Health and Wellbeing in Boston. And one of our studies that we're very proud of is called the Boston Hospital Worker Study. And this is a study that we've been partnering with Partners Healthcare in Boston. That's Mass General Hospital, Brigham and Women's Hospital. And then they've got a bunch of regional hospitals like Faulkner and Newton Wellesley, a bunch of smaller hospitals in the area. And what we've been doing with them is we've been creating a database and sort of a cohort of workers and looking at their workers and their health. And one of the things that we've done small intervention studies and different focus groups, but one of the things we've done is created what we call a total worker health or an integrated database, where we've taken data from multiple sources about the workers across the hospital. So at the center of this is mainly our workers, which are clustered in units. In the 2 main hospitals, we have 106 different units that we're working with and collecting data on. We actually have been doing surveys every couple years. We do surveys of workers. We go out and survey them about the work organization and about the work environment. But we also look at their healthcare use and spending. We have data on, because they're a self-insured company, we can look at their healthcare records and what kind of claims people are having in their own private health related issues, and I'll give you an example of that in a few minutes. We can also look at the outcome from these units, the main product of that and of these units, which is the quality of patient care. So how well is this unit actually managing the patients and actually looking at the care of those patients. We can look at planned and unplanned absence data from the payroll system, so we can actually look at the payroll. Also gives us an idea of who's working when and how for how long. We've looked at studies that looked at when people have consecutive night shifts, are they more likely to have an injury after that? And the answer was yes. We have workers' comp data, so we can actually look at what kind of claims. We can look at whether someone was prescribed opiates or not related to an injury, and then what happened after that. And then we have the injury log for the workers themselves, so the recordable injuries and the like. And then we can relate that back all to policies, programs, and practices at the hospital, measured both through our survey in terms of practices, but also policies, and also seeing how those policies, while at this big institution you'll have policies, but sometimes how they're implemented through practice at each of the unit levels can vary. And so we can understand how that variability affects all the different things. So this is a really kind of cool database. It's been in the process for about 12 years of building it to this. And we just published a paper describing it last year. And I just want to say that some of these are really typical business outcome type of measures too. These, so we're not just looking at the health outcomes, we're looking at how does this impact the bottom line for the business in terms of what they're trying to do. And it gets back to that idea of what, that healthy workers are healthy for business. And that's what we're trying to show here. And there's been more and more effort saying, that in hospitals that invest in occupational health and safety and workers' health actually have better patient care outcomes. And that's what we're getting back to that message again. So, some examples of this. So what we've been able to demonstrate in this database is a lot of what we've been talking about before. And that is that a single condition of work can affect multiple outcomes. And so that's another way of thinking about total worker health, is backing up to the idea that, that multiple outcomes will have shared pathways back into the conditions of work. And so this is an example of supervisor support. This is supervisor support. It's a classic psychosocial factor measured in the workplaces. It's often related to return to work issues and different types of things. And that, again, getting out to the Oregon Center, they do a lot around supervisor leadership training to help improve worker safety and health. And so it's a fairly common thing. And so what we've seen is that, as supervisor support goes up, risk of injury goes down, a worker's leisure time physical activity actually goes up when a work unit has a better supervisor support. Okay. And then also, their sleep gets better with improved supervisor support. So this is what we're trying to demonstrate, is that if you do, look at this one little thing and intervene on that, you're going to have multiple outcomes that can be improved. And that's sort of the second idea around total worker health that I sort of talked about, that worker making that decision. The other idea is that, these multiple pathways, there's shared pathways for multiple outcomes. Okay. Bullying at work. Bullying at work is just creates, you notice we use red, and that, risk of injury goes up. We see that people who are bullied tend to get injured, have recordable injuries. We see their physical activity going down. We see their sleep deficiency going up, meaning their sleep is getting worse. And psychological distress goes up. Okay. And there's a lot of corollaries between a lot of these health outcomes. But again, if you have bullying process or harassment stuff going on in the work, you're going to see these other health issues coming out. The other thing I want to mention is, the other kind of example I want to give is, we're just completing a study of truck drivers and whole body vibration. It's not in my slides, but Bose came out. How many people have Bose headphones for anti-cancellation, noise cancellation? Well, think of that for a seat on a truck driver. And truck drivers if you ever see a truck driver, next time you go down, keep your eyes on the road, but if you're a passenger, look at the driver, and you see that they bounce around a lot on the freeway. The suspension systems on trucks are, just they're not your Mercedes, or not even your Toyota Corolla. They're fairly bounce around, and they're actually very close to the limits, for the threshold limits for actions and things like that for exposure. And we just did an intervention, a randomized control trial, where we were looking at low back pain, because the whole body vibration is related to back pain. And so we put these seats in about 70 truck drivers, and we saw in those 70 truck drivers, yep, their low back pain did decrease after putting it in. But one of the things that we also saw was their sleep got better, which was sort of a secondary outcome. And it was sort of based on the total worker health model that we had here, was that they were able to actually, because they weren't getting beat up at work as much in terms of the vibration, they were actually able to exercise more and actually able to sleep better. And so those are some of the benefits. It's like you do one little thing, you're going to have multiple outcomes. Again, just another example of that kind of output and stuff. So we've done a lot of work around, so with this database, we've published over 40 papers looking at the relationships between the conditions of work and worker outcomes and worker proximal outcomes like sleep, fatigue, physical activity, distress, BMI, and then pain and work interferences and cardiometabolic risk and things like that. And we've looked at a whole bunch of different things from job demands, ergonomic practices, job flexibility, inadequate staffing, shift schedule control. We talked about decision latitude, supervisor and coworker support, work-family conflict and harassment. So we're seeing a lot of relationships there, and so this database is really providing us a lot of observations where we can test a lot of hypotheses around the total worker health framework. And we're very excited and proud of the work that we've done with that. Here's an example where we actually start looking at costs associated with this. And so this is looking at workplace bullying and mental health expenditures. So this is looking at some of that. And the question was that we had were, do bullied workers have greater health plan expenditures on mental health than non-bullied workers? And because of our database, we were able to capture all of that. Okay, so we had our survey that was capturing bullying, and then we had the health claims data that allowed us to look at the cost. And when we look at bullying, there's a couple ways of measuring it, but the way we looked at it was there's sort of three types of bullying, being ignored or excluded, being humiliated or ridiculed, or withholding information. And I think, and the question was, how many of these have you experienced in your work in the last 12 months? And so if no one's had any bullying or reports any bullying, their mental health care costs were here. If they had one or two of these types, it was about double. And if they had three types, it was about triple the amount of costs that they had there. So this is kind of data that we can get with this that relates the fact that bullying can be, ends up being a cost to the health insurance claims. Okay, and that's something that we wanted to demonstrate with this, and it gets back to the idea of that we're looking at enterprise outcomes, not just the health outcomes, but looking at the business part of this, and I think that's an important aspect. And so this is our conceptual framework. I put this up here. One of our colleagues says this always usually puts people in the audience to sleep, but I just sort of wanted to show you the big three boxes here that, our policies, programs, and practices related to total worker health impact the conditions of work, but that also impacts the enterprise outcomes, such as productivity, quality, healthcare costs, turnover, and absences. Those are all outcomes that businesses are usually interested in and thinking about. So I just wanted to make sure that you understand our conceptual framework isn't just about making sure workers are healthier and work, but this actually has an impact on enterprises as well. Okay, so that's sort of my bottom line message with that. So I've been talking about what can we do and sort of the solutions and where can you get better help and what's some of the ways of looking at this and doing more. So what is a total worker health solution? I've alluded to it a little bit. This is from our implementation manual. It's a management system approach to worker safety and health and well-being shaped by employee input and participation. And I think that's going to be key, and I'll talk about that in a few moments. It starts with providing a safe work environment. Think about that foundry worker saying, why should I quit smoking when my lungs are already being damaged? Okay. It builds on traditional ideas of health promotion and health protection, but it starts coordinating and thinking about the synergistic effect that I've demonstrated to you already. Okay. It emphasizes policies and practices that create organizational change that promotes safety and health, and really thinks about positive working conditions. Okay, and this idea that we think about what's positive and what works well in the work environment. And part of our work with small construction companies is we've been looking at asking them, well, what do you do well? And anybody who's gone through a leadership training program, there's a new emphasis. It's not about knowing your weaknesses, but also knowing what your strengths are and taking those strengths and amplifying those, so that, and taking those strengths to advantage. We're trying to do the same thing with some of our interventions and organizational interventions. And really aims to improve both the improve the employee and employer outcomes both together and synergistically. Okay, so what's the value added? I'm repeating this a lot to you because I want this message to come across, but it's basically, improves the effectiveness, demonstrated that already, improves outcomes, participation, and enhances a culture of trust. I was talking to somebody earlier today about what does it take to create a culture of trust, especially for environmental and health and safety professions when you go into a new workplace. And building that culture of trust is really important. But it also creates that trust between managers and the workers, which is important. Manages costs, it can reduce absence, turnover, and healthcare costs. It can generate revenue, become stronger organizations. And we've been hearing this time and time again when we go into workplaces that what our intervention and what our approach does is not only about worker safety and health, but they actually learn something about their organization as a whole and how can they be better on what they're doing with that. And it improves job satisfaction, engagement of the workers, and also promotes brand reputation. I already talked about the improved market performance. So how to get there? So this is a publication that came out about 6 years ago, actually just 2 years ago, but we worked on it a long time ago. That's the thing about academics, is the time lane. And we have 6 characteristics. You can't do this without the top management being on board, but also the middle management needs to be on board, okay? The top management can say, give it lip service, but it's really the middle management that makes things happen, because they're making more of the day-to-day decisions about what's happening in a workplace. So you definitely have to have the top, but you also have to have the middle management leadership commitment in there. And also participation of the workers for sure, but also that middle management. Those managers in the middle are often stretched in many different directions. And so really getting them involved and helping them understand how to make their jobs better and safer and easier. So many times those middle managers roll their eyes and go, oh, not another requirement for me, So it's understanding what their environment is and getting them involved as well so that they own it and that they also feel like they have an input and it's actually helping them as much as everybody else. Again, policies, programs, and practices that foster and support working conditions. It all has to go down to how does this impact the work and the conditions of work that we're involved in, whether it's psychosocial or physical or organization. How do these programs and practices really impact that? The other thing is comprehensive. It's looking at a broad spectrum of stuff, but it's also looking at how do we collaborate across different strategies. Getting back to the healthcare example that I presented earlier for safe patient handling, an important thing around that project, we did an intervention where it was a systems approach. They created a committee, but they had engineering on board, they had laundry services on board, they had facilities on board, they had nursing staff on board. I forget who else, but they had to bring in all these people. Laundry was important because they had to make sure there was enough material, the slings that they used in those lifts were cleaned and that there was enough on the floor so that there was never a holdback of like going, crap, there's not a sling in this room, I have to move this patient. So avoiding that kind of thing, but getting laundry services on board, creating that. Oh, the other part was patient care. They actually developed the patient care plan and the electronic medical records that they were using actually involved and had places for the use of the safety equipment designed into it. So when you were making decisions about how you're going to work with that patient each day, it was actually in the plan and the care and the paperwork that they had that they were going to use a lift to get them out of the bed or to transfer them or to do a boost or what have you around there. So thinking about how do you create that collaborative strategy and create sort of that whole systems-wide. Because again, think about what's going into that decision of that worker and what are all the resources they need to think about in terms of that, and that's where that comes from. Adherence, we have to comply with the regulatory aspects. of the work environment, not only just the safety and health, but also the labor laws and fair wage laws and those type of things really affect well-being, because well-being goes beyond just health, and it has many different dimensions about it. And finally, are you using data to actually help you make these decisions of what's important? You know, often people say, hey, this is a great idea, let's do it, but why? How's it going to really make a difference in terms of your workplace, and does it really apply to your workplace? So unless you have some data, you know, using data to help make decisions, but also to help evaluate what you're doing and thinking about, and using that data to help evaluate, hey, did we make a difference, and if not, why, and we can go look at it. So that using that data in terms of, like the database I talked about, that's quite complex and quite large and took a long time to build, but even simple things of what is that data? Is it interviews with managers? Is it understanding what's going on with workers? And I'll show you a couple examples in a minute. Okay. And I've learned a lot about using data to make decisions because, you know, being a professor, I like to think that I know what to do, right? But the issue is, no, I'm the last person who should be making that decision. And really thinking about what's the workplace needs and what's their main issues that they need to be dealing with. Okay, I just wanted to show you this. This is another example. I like to show you this because it comes out of the Harvard Business Review. So it's thinking about the business outcomes. David Michaels is now a professor at George Washington University in DC. He was the former Assistant Secretary of Labor under the Obama administration, looking at, he was head of OSHA, the Occupational Safety and Health Administration. I have a lot of respect for him. He wrote this, he's a great scholar and at the same time a great administrator and great policy guy. And this was a paper he wrote about, and it has a lot of what we're talking about here, starting at the top about management commitment, using the right safeties incentives, which I call around culture, making sure that the health and safety is a priority around things. I think this number 3 one is really important too. Don't blame workers for injuries. Really understand what were the conditions of work that led to this point of this injury happening, and really understanding that. Rethink how we think about injury rates. You know, there's a lot of people going for 0 injury rates, which is a great goal. Sometimes it's not realistic. In fact, we were just talking to a large construction organization, and they're like, we gave up on that because people just felt it was too much. There's the International Society of Social Security. I'm sorry, it's the International Social Security Association out of Germany. They sort of work with Social Security organizations across the globe, and they have something they call Vision Zero. And a lot of folks don't like, in the occupational health and safety, don't like that Vision Zero because, and also thinking about human factors, people make mistakes, we make errors. But the issue that they actually start off with is their Vision Zero is based on a fundamental concept that all accidents and injuries are preventable. You might not get there, but that's the fundamental idea. And with that attitude, how can we learn from those incidents that happen and understand what could have happened or what could we have done to prevent that kind of injury? But that's an important thing. And from a global point of view, that makes a lot of, they're going at a global view and trying to impact organizations across the world. So that's important. Focus on leading indicators, what's upstream. I think that's similar to what we've already been saying. Talk about, safety and health management systems. Think about embracing them, which is similar to us. I also like this last one. Welcome a regulator as a cheap consultant. OSHA, their fines aren't very large, and so brings OSHA. But OSHA has a lot of consulting services, and use them to help you develop your safety and management systems. They've got a lot of trained professionals, and they're a great resource. So I just thought I would throw this up here as another thing. And this is a quick article. He said 7 ways of improving operations without sacrificing worker safety. I thought it should go the other way around, but I think he was trying to go to his audience here. But anyway, so how to get there? We have our actual center's implementation manual. It's free. It's available for you to download. It's quite lengthy. We're trying to come up with like a cheat sheet for it. But essentially, it talks about 4 elements. 1, develop a leadership and collaboration plan. Get the leadership on board. Really think about how to create collaborations. This includes creating committees where you've got not only people from different organizations, but different levels in the organization that can help with this. start developing a plan from there and start moving forward. When you actually start implementing, we're not going to solve the world's problem. One of the things that we've been learning is it takes a while to do this with our companies. You're not going to go in overnight and do it. And so one of our ideas is start with some small victories. What's something simple you can do that can make a difference? And start building those small victories to start building confidence and trust with the workers and themselves like that. And of course, evaluate. You know, it's a continuous improvement type of model where you sort of have to keep doing sort of a plan, do, check, act kind of thing. It's a process. It's not just a once-time deal. It's actually a process that's adaptable to each different work organization that can be sustainable and scalable. And that's our idea behind it, is that, you know, this total worker health approach, there's lots of different things. You can do one-time trainings and this kind of stuff, but our approach is trying to think about something that's adaptable to each company. Every time we go into a workplace, each one's different, unique, and our system needs to be adaptable to it. So we've put forth this idea of a process that really looks, you know, where you would do an assessment of what's necessary in your company and apply it, and then go around, create some solutions, get the people on board, and move forward with it. And keep doing that over and over and over, and then it's continuous over time. One of the things that we've been learning with this is that it's helping organizations become stronger, especially the smaller ones. Okay? And I think this is key in terms of what we've been doing. So this was a study we did in Minnesota where we worked with small manufacturing companies. We worked with 3 different companies, where all we did with these is we went into the companies and we surveyed them and we looked at assessment tools. What's that first step of needs assessment? Of what do you do for this assessment? It was a year-long process with these 3 companies, and we actually went in and essentially just wanted to look at what kind of tools can help them assess what's going on in there. And with each of these companies, we actually did a whole bunch of different measurements. A lot of these are available on our website in terms of what we can do. There's the dimensions of corporate safety from the OSHA Form 33. There's the dimensions of corporate well-being, which is from Health Partners, one of our collaborators. Dimensions of corporate integration, which preceded our WISH tool, the 6 characteristics. So that's one of our tools. And indicators of integration, the CDC Worksite Health Scorecard, as well as the safety and health walkthrough, just to go through and say what's going on in this workplace. And so we we did this with these 3 companies, and what we found was that they worked really well. People liked them. These are just some of the, you know, we often with these tools, we actually had committees who did this evaluation together. It wasn't just one person, it was actually a group of people from different parts of the organization, and they actually said, you know, they would negotiate what the right answer was for that question, which actually got people, you know, just that process of asking them created a lot of assessment going on and people thinking about what, you know, how do things really work in that workplace. They used data-driven change and looking at, you know, collecting data from these surveys of saying, hey, what do we have set up? Where do we have gaps? Where can we improve? And that kind of thing, and included that. They were looking at a lot of different conditions of work in these things and a lot of different aspects. But essentially the bottom line was the tools and processes were acceptable, feasible, and actionable, meaning that they actually got data out of stuff that they could actually move forward to, and they were well received. And they, you know, what the one company said was it helped us focus on being a stronger and better company. Okay? And so again, the benefits go beyond just worker safety and health and well-being. This is what we're doing in small construction workers, subcontractors. I've been working in construction research for about 15 years now, working on safety and health issues. And one of the things that we realized was the small companies we were working with the general contractors and they had a lot of stuff in place, but these small companies didn't have stuff in place. So our current grant cycle, we're looking at small subcontracting companies and trying to give them tools to look at health and safety in their workplaces. And so what we've done is we've come up with a needs assessment where we're working with the workers. We go on site and we have toolbox talks, and this is actually my crew out talking to a work crew in Boston. And we have this poster. You can see the poster is actually hanging on the side of this SUV. We're very creative in the field of where we can get stuff posted. But what we did here was we came for 3 days, and the first day we just came up and said to our workers, hey, what are the issues that you're dealing with in terms of your health and safety? And what's good? What do you feel good about in your health? And what do you feel that's not working for your health? Okay. The next day we came back and said, okay, let's move out in this circle and start thinking about what about work makes you healthy? And again, remember focusing on the positive as well as the negative. And at first we had red and green cards, but they didn't like that because they're like, people could see what color I was sticking in the box. And we actually gave out Post-its and had people write stuff and put it in anonymously into a box. We were right there so they could, and it was happening right at the moment. And then the third day we come back and say, what do you think about the company and what the company can do to help you with this? What are they doing now that's good? Again, trying to understand what are the strengths and that kind of aspects. And it's good because, one of the issues with participatory approaches is people, the workers are just going to complain. But we try to get them to think about what's working and say, hey, what works for you and what can be, and how can we improve it and stuff like this. And what's really fascinating is the stuff that we've been learning from this is stuff we didn't expect. Okay, and it's stuff the leadership didn't expect as well. One example was we did this whole process, and we take all this data and we write a report and we go back to management and to a committee that they've created to work with us on this. We go back to them with this data and report it, and they sort of prioritize what they think is important and not, and come up with an action plan. And on this one company, what we heard time and time again about was tools. It was a construction company that they didn't have all the right tools. They had limited tools. Tools got lost. They were waiting for other people to use the tools, and then all of a sudden it was late in the day, so they were rushing to get a job done. And so all of a sudden the intervention was that the company had been thinking about a tools management system, but it was kind of, they had the capability of doing it, but they just didn't think it was a priority. By doing this assessment, it became a priority. And now the workers are, everybody's happier and feels safer. And I think an important thing is it's not just the happiness, the safety, because now people don't feel like they have to rush, they have fresh tools and things like this. Often a big thing around this is giving workers the resources to get their job done is often a key aspect. We have a former CEO of Pitney Bowles who comes and teaches in our class, and that's what he always emphasizes. It's about giving workers resources to get their job done. But how do you know what they need unless you talk to them? Okay, and I think that's the important aspect of this. And I like this. This is fun because we're taking an ecological model out to the workers and working with them and developing the data for it. So from a scientific point of view, this is kind of a neat study. So where are we going in the future? So this is sort of, I'm finishing up now and just got a couple more slides. But where are we going in the future? What's the future of work and what's happening there? This is a slide I took out of the county's report saying, from the jobs lost or gained in a certain different time, work is changing. Automation is coming. Northeastern's really pushing this idea of new education, this time of artificial intelligence and that kind of thing. But still, there's work to be done, and what's happening in just a lot of different types of jobs. We're moving away from the traditional manufacturing jobs. Even in manufacturing, we're changing because of processes and things like this. And also, the invention of technology and communication structures, how's that impacting our lives and things like that. So there's a lot going on. Cha-Cha is here, is one of the leaders of the future of work in NIOSH, and we can talk more with her. One of the last things I want to talk about is this idea of opioids, and what does work got to do with it? And it has to do a lot with it. In Massachusetts, the Department of Public Health has been doing a lot of research around work and opiates. And in fact, when you look at people who are dying of opiate overdoses and you look at their occupation, they're in high-risk occupations. Construction workers, agriculture, fishing, those type of things where risk of injury is high. And so there's some sort of corollary between the work environment and the opiates in there. And so the Department of Public Health came out with this, looking at upstream approaches to the opioid crisis, not just looking at providing people with rehab, but what are we doing to prevent people from getting on opiates from the get-go? And total worker health is a great approach to think about opiates. And I think it's a really good synergy when you think about total worker health and opiates, because it really thinks about this idea of, you start off with a safe work environment. Okay, and how can we create a safe work environment where people don't get injured in the first place? And then think about, well, once they do get injured, so start thinking, so that's primary prevention, is like getting, don't even get opiates prescribed for a work-related injury or any type of injury, right? And then the secondary is, okay, once they do get injured, what can we do to manage pain? In fact, we've got a pilot study where we're going out, we're talking to construction workers and talking about pain and understanding. Construction workers work in a lot of pain. In fact, they have to manage pain, and if the problem is if pain gets in way of them doing their job, then they'll lose their job and they don't work and they don't get paid. Okay, so often they'll do things to make sure that they can stay working. And what are appropriate pain management technology approaches that they can do? Making sure people have good return to work accommodations when they do get injured. Okay, and can you get them back to work in an environment? And so I have a colleague, Liberty Mutual. We had a collaboration with Liberty Mutual for a long time until they axed their research institute. But one of the guys there, who's now at UConn, Bill Shaw, does a lot of work around what can we do to get people back to work and stay at work when they get injured, and because that keeps them lively and also helps with their mental health as well. And then the tertiary stuff, of course, access to substance use treatment through EAP through benefits and things like that. EAP, employee assistance programs and peer support programs. The laborers union, the carpenters union in Boston is doing a lot of work with making sure they've got good rehab centers and things like that. But also another company is looking at, they're putting Narcan on their work sites and providing training for those. Because last year in Massachusetts, the number one cause of fatalities in the workplace was overdoses. So it's becoming quite common, and thinking about what can you do to recognize people who are having overdoses and what can you do to treat them and stuff. But that's fairly downstream. What can we do in the workplace upstream? And so I think that's important. So that's what I have for you today. Overall, building a culture of health leads to improved business success. I think that's the bottom line I want to present to you today through this, and a lot of ways thinking about total worker health. A little self-promotion. We have our own course. It's off in May if people want to come and learn more. It's come learn about total worker health and applying that. And with that, I'm here representing our whole center, and I want to thank them for all the work that they've done that I presented to you today, and finally thank you for your time and stuff. So thank you very much.